I have the honor, and we have the honor really in Global Health Catalyst and Global Health Catalyst Win-Win Movement to introduce to you Her Royal Highness, Princess Dina Mired, who gave us the honor to be a high representative of this global work and initiative, and guiding us and advising us. And it is an occasion on behalf of all the team of Global Health Catalyst. We thank you and we present to you our deepest appreciation. Welcome. There are long titles for Her Highness. Her Highness Her Royal Highness Princess Dina Mired is the immediate past president of Union for International Cancer Control, UICC, honorary ambassador of Global Health Win-Win Movement, patron of International Society of Pediatric Oncology, SIOP, as you know, honorary president of European Organization for Research and Treatment of Cancer, EORTC, the Honorable EORTC, special envoy for NCD for vital strategy, for non-communicable disease vital strategies, member of WHO expert group for the elimination of cervical cancer, member of the United Nations University High-Level Advisory Committee for Gender and Health Hub, member of project of ECO Advisory Board. Before I ask the first question, I would like to say, God bless you for all this. How can you do all this? God bless you, really. Let me start first with ask you, Your Highness, how do you see the lesson learned from and the importance of collaboration in the field of global cancer care based on your experience as a leader in the field of global oncology in the world?
Thank you so much, Professor Ahmad, and of course, Professor Will, for inviting me to speak at this very, very important summit. And, you know, with all the titles that you have mentioned, probably the most important title for me is to be honest, is that I'm a mother of a cancer survivor. And inshallah, it shall continue to be this way. First, and thank you for all that you do, you, Professor Will, and all the team. And, you know, I recognize so many people who are friends and colleagues who are collaborators with the Global Health Catalyst Summit, such as dear Professor Eduardo Cazab, also a colleague, past president of UICC, and others. The collaborations are, of course, extremely important. But, you know, there are collaborations and there are collaborations. There are collaborations who are sort of the fly-by collaborations, you know, sometimes, and I've seen quite a few of those in my career when I was Director General of the King Hussein Cancer Foundation for 16 years, plus during my time at UICC as president. There are collaborations, you know, even with the best of intentions, they're sort of, you know, they come in with their sort of their own agenda, good agenda. I'm not saying it's not good, but they come in with a fixed view of what they would like to do to support a country or an organization. And they don't intend to sort of walk the walk with the locals. And it's sort of a fly-by collaboration. And I find these collaborations are actually, you know, a waste of time, to be honest, as myself when I was a director, because they don't talk to you, they don't listen, they don't understand the local context. And sometimes they want to do things that you are not ready for at that time. And I give an example. When I was director of the King Hussein Cancer Foundation, I remember, you know, we were focusing on fixing treatment because, you know, we had the King Hussein Cancer Center and we wanted everybody to have quality treatment and not to have only the rich people go and get treatment abroad. And suddenly a fantastic organization from the US with great intentions, wanted us to also start awareness on breast cancer. And to their shock, we said no. And they said, excuse me, how come you say no? We said no, because we are focused, we have the resources, and we are focused to focus on treatment first. Because how can we start talking about breast cancer awareness, for example? Let the lady worry and understand about her tumor, that she has breast cancer, etc. When we can't even deliver treatment, people are not going to listen to us about taking care of themselves and coming forward for screening or early detection if they cannot believe they can survive cancer in the first place. And we said, we are going to do it when the right time comes. And true enough, once we ticked treatment and we became an accredited center and so on, then we started the Jordan Breast Cancer Program in 2006. And now it's one of the best early detection programs in the country. So when we talk about collaborations, it's fantastic when you have true collaborations who also wants to, walk the walk with you. For example, we've had amazing collaborations at that time with St. Jude's Children Memphis, Hospital Memphis in Tennessee. They were with us for such a long time, and they are still with us to this day. The NCI was a great collaborator with the center. And these were so good because we felt we also had like best friends, across the pond when we had questions, whether about governance, whether about technical stuff, training, etc. There were people there who are ready to continue the journey with us. And these are the kind of collaborations you want to see. And I've seen that also in Rwanda. Rwanda, you've got Partners in Health, amazing collaboration with the government of Rwanda. And of course, kudos to the government of Rwanda for really understanding how important also for the locals to own the project, right? A collaboration can only become superb when both ends are doing their best to fix things, right? And you've seen miracles happen. And I always tell people, collaborations are so good because you also share challenges, you share solutions. Why reinvent the wheel if you know somebody in the same region with the same sort of context, the same religion, the same language, etc. If they've done something great, copy and paste. This is one area where copy and paste is okay, because we have a big race for us with cancer and there is no time to waste. Millions of people are, waiting for their countries to fix things and save their lives.
I'm really impressed by your question. And before passing the second question to my brother, Wilfred Negwa, Professor Wilfred Negwa, I would like to say that I'm impressed because this is what we're repeating always in Global Health Catalyst. It is frustrating to think about early detection and screening without having nearby treatment. This is like torture. This is like to say, drink clean water while there is no water. It is like torture. And if you develop the cancer care in the same time, then people will come to be treated, and then you will start your campaign. I'm really impressed, and this goes exactly with a global health catalyst when we say medical physics is not away from cancer control. It is in the heart of cancer control. When we make good quality of surgery, it is not away from early detection, because if you haven't treatment with dignity, then it will be frustrating to medical staff, to people, to our families, because I say that all the planet are our families. Now I pass the question to my brother, the director of Global Health Catalyst, my brother, Professor Wilfred Negwa.
Thank you, Ahmed. I just have one question, Your Royal Highness. One of the questions, obviously, we live at a time of COVID-19. And so, as many people gather here today, and I know many people who are going to be following this afterwards, one of the questions at the back of their minds is really, what's the future of oncology, during this time of COVID and even after. So based on your experience, your extensive experience, what do you think?
Well, thank you so much for this question, because it is timely, and we're still with COVID, right? There is as if there's a third wave coming as well. Of course, we know that COVID-19 has really disrupted the cancer landscape. Just when we were getting things together and gaining momentum to do all kinds of things, COVID-19 comes in and sort of diverts all the attention to Corona. And of course, there are delays in diagnosis, early detection, treatment delays, all of these things that has really hit hard on cancer patients. And we know, 1 month delay can literally turn a cancer from being curable to incurable. So it's huge, and it creates a lot of anxiety for cancer patients. And you and I who've been through the experience, I cannot imagine how it is if I knew my son had a cancer diagnosis or a treatment to have it delayed. The anxiety would hit. So, and I know that we are going to be expecting a lot more mortality in the coming years because of that. Studies are happening. But what COVID-19 has taught us is that, it is systems. We need resilient health systems. We cannot keep competing between diseases, between infectious and non-infectious. I mean, this is what has led low and middle income countries to be delayed in getting ready for cancer in the first place, and other non-communicable diseases, right? All the attention was always on infectious diseases until, finally, I remember in 2011, it was only in 2011 that the global community woke up and say, hey, wait a minute, Africa and other low and middle income countries, they don't just have infectious diseases, they also have non-communicable diseases, including cancer. And because of that, this sort of competition between diseases, everybody was delayed in putting the infrastructure. And the infrastructure for cancer is very complicated and expensive. You need the hospitals, you need the oncology nurses, you need the oncology surgeons, the radiotherapists, etc., and so on. And this is what we fought for so long. And luckily, even though I remember feeling shocked that the first time that the word non-communicable diseases finally entered the corridors of where it matters in the UN was only in 2011. It was crazy. But what COVID-19 has shown us that, we've done all of this, but then, in one go, one virus disrupts all of that, and we're back to square one. And we cannot continue like this. A human being has one body that, we're not, one person can have communicable and non-communicable. We have one body, and we have to have resilient health systems that can cater for all. And one thing that has shown us that it's all about systems. Yes, you need the technical, it's very important, the actual technical cancer knowledge, whatever you need, all the human resources, etc. But you also need the systems in place. We've seen with Corona, major outbreaks increased needlessly just because of the breakdown of supply chains for masks. I mean, a simple mask created so much more infections and put all our health workers at risk. So what delivers healthcare? It's the system that delivers healthcare. And many times it's the other stuff. It's management, it's governance, it's the financing, it's, looking into the whole system as a whole, not just always putting all the burden on the health ministry. It's the other stuff that sometimes is a barrier and frustrates the oncologists and the health care workers, right? So we need also to have to reimagine public health. We need to, look what Corona has taught us and actually take note. And I think in the future after COVID-19, we've seen a lot of, like these meetings going on Zoom, tele-oncology, on cancer prevention and control, all the trainings that suddenly, the cancer community adapted because of Corona, right? They've had a Zoom meeting with patients, tele-oncology conferences, trainings, etc. I think that's a good thing. And I think, it allows many people, like this summit, right? Maybe in the past you would have been able to get, I don't know, maybe 500 people. Now you have thousands who can register and actually access this sort of high-level conference. Trainings and so on. Can you imagine, why didn't we do that before? I know the ECHO project that I've been part of. It's an amazing organization that I'm not sure you guys are connected with it. I can connect you. They've been doing this as well. There's so much scope for training. I know at the King Hussein Cancer Center, even well before Corona, we've had, the staff had weekly trainings from St. Jude's Children's Hospital with their team at King Hussein Cancer Center for second opinions or for rare cancers, etc. There's a huge scope, and I really applaud your summit and the Global Health Catalyst model and the win-win model for actually riding on all of that well before Corona, actually, and utilizing, new technology to be able to reach out more people and saving money, right? Not everybody can have, not many organizations can send 100 people to come over to the US. You're actually bringing education to their doorstep. So I think, that's one of the good things that came out after Corona. I think it should continue and even explode further. And I know you have your amazing, this C4 platform, cloud. I don't know, I'm not very knowledgeable about the particular technology, but that's fantastic, and I applaud you for that.
Thank you so much. Yeah, there's a lot of chat activity, really applauding you for your leadership also, and the point about resilient healthcare systems. In some ways, it's like, COVID made, things like the technology you just mentioned become part of the healthcare system, things people need to take into their healthcare system, take that into account, and so, a lot of people are really appreciative of your leadership. I still remember 2011 when you gave that, is it 2011 or 12, where you gave that UN speech? Yes. How that kind of thing catalyzed, change, inspired so many people. So thank you so much for that. I'm going to give Professor Ahmed another chance to give one more question. Professor Ahmed.
First, when I said, just comment on the nice answer of Her Royal Highness. I am really again impressed, because it is when I said leadership of Her Royal Highness was not exaggerated. It goes exactly with what we said in our one of the chapter of our new book, Approaching Global Oncology, the Win-Win Model. The keynote and forward was written by Her Royal Highness Princess Dina Mired, and one of the chapters was about COVID, and it was about searching and finding lights in the darkness of COVID-19 that can serve and develop cancer care and research, and not to look always for the bad sides, searching for the light. So when I say that we are going exactly in the same way, and with your leadership and with your guidance, that this is not exaggeration. My next question is, what opportunities and actions you would like to see, and you would like to hope to see for in the field of global collaboration and action for increased affordability of better value cancer care?
Yeah, I think there's a lot to be done, and you are doing great in giving access to many people, and I like the fact that you're giving access to research, because there has been such an imbalance. All the research has been done only in high-income countries, and I think this has to stop. We have so many talented people in all our countries, low, middle-income countries, but they haven't had the chance to be able to publish their research. It hasn't been easy, and I've even heard it when KHCC, they would tell me that every time they want to publish something, they needed somebody else from a high-income country to be able to publish their paper, and that has to stop. So I think it's great that you guys are supporting everyone in uplifting the quality of the research and so on and so forth. I think it's very important, and I cannot stress more the importance of also countries themselves, owning the projects, because collaborations are great. You can bring the horse to the water, but you cannot force the what is the saying, the horse to drink. I think from my experience as a former Director General of the King Hussein Cancer Foundation, the reason that we managed, me and the team, to turn around our center from a center that gave no hope to an accredited cancer center that now serves millions of patients, not only from Jordan, but from the region, is because we also did what we can. We also organized ourselves. We saw why is it that we were not succeeding. Jordan, we have doctors, we even had the infrastructure, we even had the machines. Imagine, we had all of that, but we couldn't deliver cancer care. And from my experience from UICC, throughout all my travels, a lot of the problems were about governance and management. And I would love to see the Win-Win Initiative and the Global Health Catalyst to also focus on that, to talk about health system strengthening, to give the tools for that as well, and to encourage those countries to also organize themselves. And here I would love to share with you later on offline the City Cancer Challenge model. It's one of the models that UICC launched, and now it's a standalone foundation. And I was such a champion for that model because it hit home with me. I wished I had that model to help us when we were doing our journey. And it basically is, countries would have their own, they have to organize themselves on the ground politically as well, to have city cancer task forces that has everybody sitting on the same table, not just the oncologists, the mayor, the nurses, the patients, the private sector, etc., all sitting on one table, and they do a gap analysis. And this is what CCAN Foundation does. They support them to do the gap analysis, and they help them go through the, putting their priorities, the action plan, costing the action plan, and so on. This is the difficult part. And when you have that, what happens is suddenly the city has one plan, and then they ask support from other institutions all over the world. Because what happens normally, many institutions, even like I said, with great intentions, they come into a country, they want to do something, and then half the time another organization does the same thing, and nobody knows. There is wasteful resources and inefficiencies. But once you have the country organize themselves on the ground, I call it the managerial infrastructure on the ground, and they have one plan for the city, then when everybody else comes, imagine Win-Win or the Global Health Catalyst, you want to support with radiotherapy or physics training and so on, you zoom into the plan and the needs. And imagine if everybody else does, whether for childhood cancer, cervical cancer, and so on, then you accelerate everything else. So I would hope for more coalescing of which is what you guys are doing. You are catalyzing everybody to coalesce, and I see that now. You have Johns Hopkins, Oxford, you have all these other organizations coalescing into one, and this is what we need, because too many cooks sometimes really spoils the food, and the fact that you're joining together is huge, and it's so helpful for countries. But I call on also countries to do their bit. Nothing is easy. You cannot be passive recipients of support. If you want to accelerate, you can. Jordan was a low middle income country, and we did it. If we can do it, everybody can do it.
Wow, we can listen to you for.
Please, brother Will, I would like to just have a comment, because I am very glad, very happy, because it seems like we are playing the same melody, yes, with Her Royal Highness and with the whole orchestra, And that is what we insist. I like it very much, the expression of catalyst that my brother Will, who put it, suggested. And in all our communications, in all our presentation, in the book, it is some chapters speaking about, we are speaking always about all stakeholders. When we say win-win, it includes all. Pharmaceutical industry is not against, but with government, the community. Even when we say local cancer services in Africa, we would like to include the healers, not to be against what we are doing, but include all. Exactly, include all partners. And when we say scientific approaches, we don't mean chemistry or physics or medicine. We mean also business. Very important, economy. We would like to include Harvard Business School, for example, from England, from experience from Jordan. And your experience, wide experience, we know that you have a big experience in such things. It is very important because there are many economic and financial complexities behind the lack and shortage of many things in the world. So when we say scientific approach, it doesn't mean that physics or medicine or pharmacology or trials, but also science in business, economy, and all aspects, behavior sciences, psychology, because it includes people, and to see all feeling that they are partners in winning, all would win. Allow me to pass the next question to my brother Will.
Yes, thank you so much. I agree with you, Ahmed. And actually, I want to also say, Your Royal Highness, that we will definitely follow up with you on the potential collaboration with Project ECHO. I think that, it's, in the spirit of what we've been talking about, that would be fantastic.
I will be more than happy to connect you.
Yes, yes. Yeah, so we do know that your time is limited.
Cancer challenge model as well. I will connect you and see what you can find. Yes.
Yes. So we do know that your time is limited. Actually, we can go on and on. I think we probably need to schedule like an hour. But we would like to the last point is just to, what closing remarks do you have for the audience? If people are listening to you now and are saying, okay, we're so inspired with, all the comments coming from the chat are saying how they are inspired and by your passion and leadership. So what would you tell the audience if they want to get involved in cancer?
Yeah, thank you so much. We can do something. But I believe in actually, countries and collaborators and donors, etc. They have to also encourage countries to have national cancer plans or national NCD plans, because this is where, you really organize the work, right? A lot of, unfortunately in health, a lot of the times we are not using business models. If we use the commercial models of businesses, we wouldn't be where we are. Organizing oneself, whether on a managerial, governance structures, science, as you name it, having everybody on the table, fighting what are the priorities and going through the strategy, the action. This is where the real work is. And unfortunately, sometimes we forget all about that. This is the important foundational work that needs to take place before we start to sort of throw in resources and do all kinds of things. That's where you can accelerate. We can fight cancer, it can be done, but once you have national cancer plans, well thought out plans that also talks about prevention and, the money can be found, it is there. If there is political will, countries can have, put taxes on tobacco, taxes on alcohol, taxes on unhealthy food, and so on. It is a win-win. Then countries will have the revenue to be able to put it back into the health issues that they have. And I really call for everybody to join you all on your fantastic catalyst model. I love your mission. I love your vision. The fact that you're not competing with anyone, you are truly catalyst. And I wish, and you are bringing big giant institutions together. I'm so proud to be working with you, and I continue to be your ambassador, and I'm ready to support you in any way I can. Thank you.
Oh, wonderful. Thank you so much. Thank you so much.